I'd like to introduce Heather, and Heather's a 21-year-old student.
Yep.
And Heather, you were telling me 4 surgeries
Yes.
on your knee in 6 years.
Yep.
And your first surgery was when you were 15 years of age, and it just didn't work out, and you had a failure. And then you had another surgery and another surgery. And we decided that it was time to get stability to your knee joint, but you'd had so much surgery, we decided that we would do a graft from your other knee.
Yes.
And when I first presented that to you, that we were going to go to your good knee to get a graft, how did that make you feel?
I was a little bit nervous because this
Yeah.
is the good knee.
That's right.
So I was
That's
nervous
right.
about opening up the good knee. And
Absolutely. And you have every right to be nervous about that. I would be too. But the advantage to you as a patient is if we use your own graft, we have virtually a 95% success rate. And if we used a transplant or something, it drops down to much lower levels. And so we encouraged you to make the decision.
Mm-hmm.
And you're only 5 weeks from surgery.
Yes. Yep.
And can we show off a little bit?
Sure.
All right, so you're only 5 weeks, and you straighten up your leg. And we took out a bone, tendon, bone graft.
Mm-hmm.
And we do this through a little incision, cosmetically placed, and then we take this skin flap like a plastic surgeon, and we go all the way around here to be able to do it.
Mm-hmm.
So you had a little swelling around there, but then that quickly went away.
Mm-hmm.
And we graft the little defect here and there, so when I rub my hand over, you can't feel any defects there,
Yep.
right? And how bad was it? And you can be honest, first couple of weeks it hurts a little bit?
The first week it was a little bit painful just because I think for me it was a lot of the shock. I never had this is the good leg, this is supposed to be the one that I put all the pressure on. But after the first week it was virtually no pain at all.
Well, that's great. And we probably have a disclaimer there because it usually will hurt a little bit for 2 weeks or so, 2 to 3 weeks. You would expect that. But now you're only 5 weeks. You have a weight on your leg. And so bend up and down for us and show off for us. And we think that was a very good
Yes,
decision.
it was a very good decision.
And now, and just to fast forward, the other knee and straighten your other knee, and those aren't all of our incisions. We've had to use previous incisions.
Yes.
But you see, we still close that cosmetically, and we don't have any railroad tracks. And after 5 weeks, that's also doing well. You now have a stable knee here.
Yep,
So
I sure do.
we think we're through with this multiple
Yep.
scenario,
Yep.
right?
Yep.
Okay, good. Well, thank you for telling us that. We want patients to know that when we're recommending to go to the good knee, there has to be a substantial reason why we would do that.
Yep.
And or otherwise we wouldn't do it. And I'm really glad you've had such a good result.
It was a good decision.
Okay,
Definitely.
good. Thank you.
Thank you.